Khon Hospital is an excellent trauma center which proceeded since 1992 by Dr. Withaya Chatbanchachai and had been supported by JICA and WHO. Trauma and critical care of Khon Hospital was established as a model unit for the inclusive trauma care system. Khon Hospital is also the WHO collaborating center for injury prevention and safety promotion. Nowadays, the situations of emergency room indicates a rising number of injured patients as well as increased events, disasters, and severe accidents. Traumatic patients with emergency conditions have been evaluated and provided proper care and treatment immediately to prevent of death and disabilities. Therefore, the emergency medical staff should develop their facility and competencies to be able to provide appropriate care for traumatic and emergency conditions according to the context of the hospital and public health problems. Emergency care system in Khon includes prevention and promotion of RTI, road traffic injury. We integrate RTI prevention policy in hospital and implement the public awareness of RTI prevention. We conduct the injury surveillance systems to collect mortality rate from 3 databases to investigate of RTI and use the GIS or Geographic Information System to identify the risk point of accident and analyze data. We are the only one institute in Thailand which established the community center and cooperate with WHO in RTI prevention. There is law enforcement action by having checkpoints of helmets and the speed limit area 80 km per hour on Mitraphap Road, 14 km in city area. Pre-hospital care, there is an emergency response team to all areas of Khon. We have a call center and this network can link to provincial, district, regional, and central levels. We have the advanced life support team to perform emergency resuscitation at the scene for 24 hours. There are more than 100,000 EMS actions per year in Khon Hospital, which is the #1 of Thailand. We also established Khon EMS Foundation to support the EMS equipment for the first responder and rescue unit in every district in Khon. We provide and install the central AED system, which can be used via wireless network for early resuscitation. We have GPS ambulance tracking in each ambulance in Khon to measure and control the speed of ambulance, not more than 90 km per hour. Development of ER quality. We conduct the emergency system to provide emergency treatment and care for all aspects, and using triage to screen and care for emergency patients. Emergency physicians and specialists provide care 24 hours a day. We have 8 fast track for emergency conditions including STEMI, stroke, sepsis, newborn and high-risk pregnancy, traumatic brain injury, spinal injury, and multiple trauma be tracking by our emergency system. For complicated conditions, we have the consultation system with all subspecialties. In hospital care, we develop the quality health care for traumatic patients by experienced medical staff and skillful nurses to coordinate and manage the caring system of traumatic patients. We also developed the quality trauma program by using trauma patients' data to analyze the probability of survival and awareness of adverse events and perform the action plan to solve the problems. Our patient care system, which indicated the continuingly decrease of mortality rate, have been set to be a model for WHO. The referral system, we have an ER call center and developed the tele-referral monitoring or TEREM, using wireless network to share the vital signs monitoring of the patients. We develop the patient care process by setting the online medical connection for the consultation with emergency physician directly. During transfer patients, an emergency physician can suggest and recommend the proper treatment immediately. The system has been installed to every district hospital in Khon province. Disaster management. In case of disaster situation, we develop a medical and public disaster plan by setting the Public Health Emergency Operations Center an emergency response team to evaluate risk area and implement the emergency response policy. We conduct disaster preparedness and practice training every year. The Knowledge Management Center, we have 7 trauma and emergency care training courses per year for medical doctors and nurses. We have trauma registry program and reports data annually since 1989. We are the first hospital in Thailand using the trauma registry data to analyze for action trauma planning. We also have published medical journal and manuals for prevention and treatments of traumatic patients, more than 200 topics, and distribute them via electronic file with being downloaded 20,000 times per month. Finally, the Coordinated Emergency Trauma Center has been up and running since 1989. We have reviewed our outcomes and set the new strategy every year. We all cooperate with community network to set the policy and target to achieve the goal. We also have planning to support the emergency care system and extend to cover in non-trauma emergency patients to decrease the mortality rate and severity of disease, as well as decrease disability and sufferings. We are tightening the relationship between in-hospital teams and our own networks to be unique for a good health and quality of life for all patients in Khon and all of Thailand.